Welcome, doctors. Let's be real for a second, most clinics are running full speed ahead every day, until insurance verification throws a wrench into the workflow. It's one of those behind-the-scenes tasks that nobody really talks about, but we all feel the impact. Billing headaches, rescheduled appointments, denied claims. You know exactly what I'm talking about. One clinic put it perfectly. We spend so much time chasing insurance, we barely have time to check in patients. And that's where virtual medical assistants, VMAs, from Staffingly, Inc. come in. Not just to help, but to take this entire process off your plate. The problem with in-house insurance verification, let's be honest. Your front desk staff is already juggling phones, patients, schedules, you name it. Now we expect them to handle real-time insurance verification on top of all that? It's a setup for mistakes. Here's what usually goes wrong. Eligibility checks get rushed, or skipped. Portals time out. Phone queues drag on forever. Plans change, but no one catches it until the claim is denied. And burnout? That just leads to turnover, and then you're training someone new all over again. I heard from one clinic that had to refile 30 claims in 1 month just because of insurance info errors. That's 30 headaches, completely avoidable. The hidden costs, and it's not just about fixing errors, it's the ripple effect. Delayed care, because coverage wasn't confirmed. Denied claims, because the info was missing. Lost revenue from empty chairs when patients are rescheduled. And stressed out staff who are spending more time on hold with insurance companies than actually helping patients. One practice told me, I can't keep asking my front desk to check benefits while handling 5 incoming calls, and they're not alone. The solution: virtual medical assistants from Staffingly, Inc. Here's the good news: you don't need more front desk staff. You just need smarter support. That's exactly what you get with virtual medical assistants from Staffingly, Inc. These are real, trained professionals, HIPAA compliant, fully integrated with your systems, who handle insurance verification before the patient ever walks in. Here's what they take care of: pre-visit eligibility checks, real-time logins and phone verifications, documentation straight into your EMR, and even reaching out to patients with coverage or copay info. One clinic shared, "We used to check insurance the morning of the appointment. Now it's done 24 to 48 hours ahead." Total game changer. Why it works: this isn't some automated chatbot. These are real people, trained, experienced, and synced with your workflow. The result? Fewer errors. Faster verifications. No more last-minute surprises. Your front desk team? They finally get to breathe. Your billing team? They see fewer denials. Your patients? They get care without unnecessary delays. One doctor told me, "Outsourcing to a VMA saved us hours every week. Our billing team noticed the difference immediately." Seamless integration into your workflow, and don't worry about systems. VMAs work with all the big names. They log into your systems remotely, follow your workflows, and communicate with your team in real time. Need patient updates or follow-ups? They've got it. It's like having another team member in the office, without the overhead. So here's what we've learned. Insurance verification is essential, but it's overwhelming when your in-house staff is already stretched thin. Mistakes here lead to denied claims, delayed care, and burned-out teams. But with virtual medical assistants from Staffingly, Inc., you get accurate, fast, and consistent support, without having to hire or train anyone new. It's a smarter way forward. And honestly, your team and your patients deserve it. Now, a few quick things doctors are asking. What's the difference between a VMA and front desk staff? VMs work remotely, focusing on back-end tasks like insurance verification, so your front desk can focus on patients. Can VMAs access our EMRs safely? Absolutely. Staffingly's VMAs are HIPAA compliant and fully trained on secure EMR access. Do they really help with denied claims? Yes. Because verifications happen before the visit, you avoid the errors that lead to denials. Will patients know we're using VMAs? Not unless you tell them. VMs work in the background. Your patient interactions stay personal and local. How fast can they verify insurance? Most verifications are completed 24 to 48 hours before the appointment, often faster than in-house. So if insurance verification is slowing you down, it's time for a better solution. Let Staffingly, Inc. set you up with a virtual medical assistant, so your team can focus on what really matters, your patients. Thanks for watching, doctors. See you next time.